In today's vlog episode, we're talking about why I feel immunotherapy is going to be a game changer in the way we treat conditions. So in terms of what it is, why it is so beneficial for cancer, asthma, cardiovascular disease and many more, and why I feel it's going to change the way we actually approach medicine and the way we treat people in general. Hey guys, if you're new here, my name is Aamir Hussain. I love to talk about research, so much so I decided to make YouTube videos just about that in terms of tips and advice for the research life, but also some interesting topics of discussion, which is what this vlog is all about. So if you want to stay tuned, do consider subscribing, as you can see down below. But let's get back onto the topic of hand, which is what is so special about immunotherapy? What is it even? Let's just start with that really. There's no point going into the super science stuff if we don't know what it is. So essentially, immunotherapy is something that alters our immune system to try and normalize it back again, because previously it was either overexpressed or underexpressed in certain parts of our immune system that unfortunately gives rise to certain conditions that we see, whether it's cancer, severe asthma, rheumatoid arthritis, cardiovascular disease, even diabetes. And there's an argument to say, which I'll talk about in the part of this vlog, that an abnormal immune system is a key unfortunate trigger or precursor to a lot of conditions that we see around the world. So as I just mentioned, you might be wondering, okay, why is this really important? If something is overexpressed, sometimes we have drug medications. You might have seen somebody who has a gastrointestinal problem, and they say it's certain medications to stop the cells that secrete excess acid, what we call proton pump inhibitors, PPI, as you might have said. So see, some of these medications you can see here are related to treating the symptoms and you can say the end stage of that type of condition. But why I feel immunotherapy is such a game changer and is becoming a key part of treatment options where possible is that it targets the root cause of that particular issue. It doesn't target the symptoms, doesn't target any intermediate actual aspect. It tries and targets the root cause to the best of its ability of that particular condition. So then you're probably wondering, okay, there's something that tries to re-normalize our immune system. Okay, that sounds pretty cool. Because unfortunately sometimes our immune system is underexpressed or overexpressed. But then how does this work in a real world setting? What is this related to? That's what this part of the vlog is going to be about, is now mapping immunotherapy to clinical setting, i.e. how does it work with actual diseases? So let's talk about the diseases right now. So let's start with an unfortunate disease we know a lot about, but which we know even more, and that is unfortunately cancer. Now, with a lot of cancers, we know as cancer is being a cell that is uncontrollable in its ability to proliferate, in terms of grow, and it gets out of control, and that's what we call a tumor, that's what we call a cancer in simple terms. Now, the way that can potentially occur is when certain proteins and their function is, i.e. either to regulate cell survival or regulate cell proliferation, to make sure a particular normal cell is behaving the way it does, and if it's growing a bit too much, let's stop its growth. So when these proteins are perhaps underexpressed, and maybe certain proteins that are related to cell proliferation are overexpressed, you're going to have then a recipe to grow a tumor. Now, you can have anti-cancer therapies to kill those cancerous cells, but then the way immunotherapy works is to actually normalize the underexpressed protein and normalize the overexpressed protein, depending on which medication or type of immunotherapy you're using. And that can start to regulate the immune system back again to reduce the problematic cancers from growing anymore, and even those that potentially might be precancerous, stop them from growing. It's a more targeted approach to treating people with diseases. Same thing applies with severe asthma, something I know a little bit about because that's my basis, that's my area of research, where most forms of life-threatening asthma where people are hospitalized, they're in intensive care, they're on all sorts of medication and steroids, is when a certain part of the white blood cell family is uncontrollably being activated and secreted and damaging part of the body. So there is an overstimulation or overreaction, what we call hypersensitivity reaction to, even cold air or pollutant or some type of allergy, some type of dust perhaps, and the body goes into hyperdrive. So what immunotherapy does is, to some degree, it actually stops the production of that particular white blood cell, where the conventional therapy is to just stop everything. That's what steroids are used for, is just to stop everything in terms of our immune system. Now that is what we call kind of a blitzkrieg approach, where you just decimates everything. Unfortunately, there are a lot of side effects. But with immunotherapy, it's very targeted to that particular white blood cell, or that particular what we call cytokine, so these protein messengers, or these little proteins that have a lot of immunological function. Immunological function, IMMUNOL. Why am I immunological function? You get what I mean. So these immunotherapies are very essential for that function. The reason why I'm mentioning all of this is that with current therapeutic options, there's a lot of side effects. There's a lot of unfortunate lack of efficacy because you're targeting many things. It's not actually a precision approach. You can have a lot of off-target side effects. You're not actually going to maybe treat the underlying cause. And why I feel from an immunological standpoint that this is becoming a game changer is predominantly in terms of conditions. A lot of diseases start when there is an abnormal function in our immune system, right? So let's look at cancer. As I just mentioned, some proteins are not behaving the way they should, either overexpressed or underexpressed. Severe asthma, same thing, something is highly overexpressed when it shouldn't be. And these are related to actual proteins or immunological markers. Same as rheumatoid arthritis. Even same with cardiovascular disease. There are certain proteins that are not functioning the way they should, and some that are maybe in affecting the cardiac muscle or affecting blood vessels. And even parts of diabetes that are known that excessive immune function can be damaging the pancreas, can be damaging all sorts of, even our brain, that is related to what we call type 2 diabetes, which can be argued as Alzheimer's. So we know that the immune system, if it's not controlled, if it's not regulated, it can lead to all sorts of problems, which is why if there's a therapy to normalize what is overexpressed, what is underexpressed, or what is abnormal, that is a good sure way to try and reduce the severity of the condition, be more effective, be more efficient, less side effects, and you're then targeting the root cause of the condition as opposed to just treating the symptoms. However, it is not all sunshine and rainbows in the rules of immunotherapy, because the golden rule of pharmacology is you change something, something else will compensate. If you inhibit something, the body will compensate to do other things. So unfortunately, even though in theory and in practice there is a lot of potential and there has been a lot of improvement in patient survival for all various forms of conditions with immunotherapy, it does come with the side effects in the sense of, for example, let's say you are shutting off part of an immune system in terms of a particular white blood cell. So we know about neutrophils, eosinophils, and basophils. If you're not from a science background, don't worry, I'm just talking about different forms of white blood cells. So imagine you shut off the production of one in particular, but the body compensates by trying to keep the rest of that pathway that white blood cell affects via different routes. So it overcompensates to try and do that. And unfortunately, if you are shutting off parts of the immune system as opposed to shutting off all of it, which is the non-precise approach or non-targeted approach, you then potentially lose that function of that white blood cell for other purposes. So we know that certain white blood cells have not just immunological purposes, but may have anti-cancer built-in properties. They may have other properties. And because immunotherapy is so precise, it's actually so effective, when you completely shut it off, you might completely lose other properties. And we have seen, unfortunately, where people who have taken immunotherapy and it's worked to completely cure them of one condition, it's set themselves to be exposed for potential other conditions in the form of cancer. Somebody who has severe asthma, they might be susceptible to some tumors already in the body becoming more and more aggressive because they've lost the ability for other immune functions. And that's something, unfortunately, to bear in mind with immunotherapy. Even though I feel it's going to revolutionize the way we look at medicine, because as years go, we'll have more and more options in terms of antibodies or these agents that will target a particular part of our immune system. It'll be a lot cheaper, it'll be more readily available for certain. It won't be mass produced because unfortunately it's not that cheap to make. But I do feel that unfortunately it will change the way we approach treating somebody who has a severe condition. And that's what I'm trying to get at with this vlog, is that amongst the various therapies that we have, you know, nanotherapy, we have, you know, maybe certain forms of radiation, we have even new forms of viral type of targeted therapies. A lot of people do look at immunotherapy as one of the best approaches we have, or the best weapons we have to try and target severe conditions. And I feel there's something I want to just raise in the vlog, because I try to make these vlogs more thinking of a certain research topic or opinion and sharing my thoughts for those who may not know about the importance of it, and just kind of share my, what we call, 2 cents of information that I hope you might find valuable. This is slightly different to the, you know, the tips and advice videos I share on this channel. For those who don't know, there is a playlist up here of various forms of advice if you are a research student, masters or PhD, so do check them out. But I'm hoping to share, you know, a bit of variety on the channel. I have a new video coming up very soon. I don't want to give any promises in terms of dates, but it's a video all about how I quit sugar and junk for 30 days and sharing the results of how I felt or how my body changed. And if you're interested in that, do let me know down in the comment section below, because I would love to see if you think that type of content will also be good for the channel. So let me know if you found that video useful, if you enjoyed it, because I did. I like to share, I like to teach, and I think this little vlog was sort of teaching, but I shall let you enjoy the rest of your Saturday evening. Please do consider subscribing if you can. It will be very helpful for me and the channel. I do have an Instagram page as well, if for those who may not be familiar, Aamir.phd, where I share, you know, shorter form contents related to research that you might find valuable. But in any case, I shall see you in the next one. Take care.